Hey guys, so in today's video we're going to be talking about how to find a therapist. I think that therapy is one of the most helpful things for anybody dealing with mental health issues, trauma, anything like that. But without the right therapist that's a good fit for you, therapy can be really ineffective and sometimes bad and sometimes make you feel even worse. So today I just wanted to give some advice on how to find a therapist that's a good fit for you and that's going to be able to help you. So when I first started going to therapy, I saw 3 different therapists kind of in a row. I think there was a few months in between each of them. And the first 3 that I saw were not good fits for me. So the first one that I saw was in college, and she was just a very old school style therapist. So all of my sessions were very much, and how does that make you feel? And things like that. And it just didn't work for me at all. I only saw her for a very short period of time just because I didn't find her style of therapy helpful at all. The second therapist that I saw started off kind of helpful. It was someone who was recommended to me by someone from my church. And initially I thought she was a good fit up until I started kind of talking a little bit about my issues with suicide. And that's when she became really invalidating and just didn't really know how to handle my suicidal thoughts and stuff. And then the third therapist that I saw was just a really bad fit overall. It was, again, a recommendation from someone from my church. And kind of like the last one, she started out okay, but I just never felt comfortable with her. One of the things about her was she only did video appointments. And I didn't really like video appointments. I preferred to be in person. So there was already kind of a level of discomfort that I had with the style of her therapy. And then eventually, when I started to talk about my suicidal thoughts, that's kind of where things took a turn for the worse. And she told me that I was possessed by a demon, and it was this whole thing. But she did not work out, so I stopped. So then I eventually found my fourth therapist, who is a therapist that I'm still with, and he is fantastic. So I want to give a little bit of advice on how to kind of skip over some of the bad therapists and find someone who's a good fit for you. So the first thing that I recommend is using Psychology Today. That's the website I use to find my current therapist. And the great thing about Psychology Today is that you can search for therapists and filter by if they accept your insurance or what style of therapy they do or what their specialties are and things like that. And that's really, really helpful. So besides that, and kind of going along with that, the first thing that I recommend is that if you have an idea of what mental illness you're struggling with or what kind of trauma you're struggling with, look for someone who has experience in treating those things. So if you are someone that has OCD, look for a therapist who specializes in OCD treatment. Or if you have trauma, look for someone who's trauma informed. And this is really important because for certain types of trauma, different types of therapies aren't going to work. For example, someone like me, I have complex PTSD. And the first 3 therapists I saw all did cognitive behavioral therapy. And CBT is great for some people, but typically for people with complex trauma, it feels really invalidating. So it's really important to look for someone that specializes in the type of trauma that you have or the type of mental illness that you think you might have. The other thing that I really recommend is finding a therapist who will do a free consult for you. Typically, when you start therapy, your first appointment is going to be an intake appointment, and intake appointments are really long, and they involve the therapist asking you a million questions about your history, about trauma, about your symptoms, family history, things like that. In intake appointments, you don't have to go into detail about your trauma or anything like that because it's, your first time meeting with this person, but it's just the way that the therapist can get a background and kind of an idea of what types of things that you're struggling with. The reason I recommend trying to do a consult before is because the intakes, like I said, are really long and really exhausting, and it can be really frustrating to go through an entire intake appointment just to find out that the therapist isn't a good fit for you. consults can help you get a feel for the therapist and their style and things like that, and kind of help you decide if you're comfortable talking to this person. So for me, when I did some consults when I was finding my other therapist, kind of the first thing I was looking for, and maybe this isn't, the best thing to be looking for at first, was, for me, I really like a therapist that uses humor and that seems very genuine and empathetic and also shows their emotions. So when I did my my consults, I keep doing that. When I did my consults, I did 2 different ones when I was finding my 4th therapist. The first consult that I did, the therapist was very rigid, very kind of like the blank slate style therapist where they don't show any of their own emotions. They're very flat. Some people really like this because they feel a lot more comfortable talking to someone who maybe doesn't seem quite as human. Sometimes that makes it a little bit easier to talk about really difficult topics that might come up in therapy. But for me, when I did the second intake with the therapist who's now my current therapist, and by intake, I mean consult, he was really funny and he seemed very genuine, very empathetic. And I really liked that. So that's how I kind of found a therapist whose style kind of fit what I was going to be the most comfortable with. So when you're doing a consult, there's a couple of questions that you can ask, or that I recommend asking, to help you decide if this therapist is the right fit for you. The first thing that I recommend asking is what type of therapy this particular therapist specializes in, and what they think its strengths are, and what types of mental illness do they think it is most valuable for. So my current therapist is a dialectical behavior therapist, and he is also a trauma-informed therapist. So when I asked him this question, he told me a little bit about DBT, told me that it's really good for personality disorders, which is one of the things that I have, and also really good for complex trauma, which was another thing that I have. The second thing I recommend asking is asking the person, do you have experience with treating this specific type of mental illness? So whatever it is that you're concerned about, if it's anxiety, depression, trauma, OCD, any different type of mental illness, ask them if they specifically have experience treating it. The third thing that I recommend asking them, and this one was really important for me, was to ask the person if what their protocol is when dealing with topics such as self-harm and suicide, and ask them if any mention of suicide leads to hospitalization, or are they equipped to safety plan and assess risk before jumping to hospitalization. This one was really important for me to know because I struggle with chronic suicidal thoughts, so I needed to have a therapist that was going to let me talk about them and help me work through them rather than hearing them and then sending me to the hospital. So this one was like super important for me. Another question I recommend asking is, what is your policy in contacting you outside of session? So the first couple therapists that I saw, it was no contact outside of session. So like I could send them an email if I had a conflict, or call to reschedule if something came up, but I wasn't really allowed to contact them with any issues I was having in between sessions. My current therapist is a DBT therapist, like I mentioned, and one of the things that is built into DBT is coaching calls. So you're allowed to call your therapist. Usually they have set hours outside of session if you need some help with things. My particular therapist also allows me to email him because sometimes I have a hard time expressing things in person. So it was really important for me to have a therapist that would allow me to send him emails before and after sessions that could help inform what we should talk about in my next session, because I had a really hard time bringing things up if I didn't first bring them up in writing. And then one of the last things I recommend asking is, if it's necessary, can you refer me to a psychiatrist that can prescribe medications? Finding a psychiatrist can also be a really difficult thing to do, just like finding a therapist. So it's helpful if you're going to need to be on medication. It's helpful if the therapist has an idea of someone who can prescribe for you, or has someone that they work with that is a prescriber. So to conclude this video, I just want to say that probably the most important thing is that you find a therapist that you feel safe with, that makes you feel validated, and feels like they're taking you seriously. If you find that your therapist isn't a good fit for you after a few sessions, that's totally okay and normal. You might have a consult that goes really well and intake that goes really well, but then as you start to work with them, you realize maybe their style doesn't quite fit what you need, and that's totally fine. I didn't know that when I first started seeing therapists, so I stayed with some of my therapists for a lot longer than I would have if I had just kind of realized, like, hey, it's okay for me to find someone else. And it's also okay to bring this up to your therapist if you find that they aren't a good fit for you, because oftentimes a really good therapist can help refer you to someone who's better equipped to handle your specific problems. So that's it for today's video. Thank you guys so much for watching. As always, if you have any questions, please leave them in the comments, and I will do my best to answer anything. I've gone through a few intakes, a few consults, and things like that. So any questions that you have, please feel free to leave them, and I will answer them as best as I can. And thank you guys so much for watching this video, and I hope you have a great rest of your day.